Welcome to our webinar today, hosted by the American Public Human Services Association and one of our strategic industry partners, Change and Innovation Agency, a Venmo company. My name is Donna Jarvis Miller, Director of Membership and Events at the association. I would like to take the next few minutes to give our audience a quick overview of APHSA and the work the association does for our members. APHSA represents state and local health and human service agencies, and we aim to deliver value to our members by influencing modern policies and practices, building more capacities through access to professional education and development conferences, technical expertise, and our organizational effectiveness practice, and connecting members to national policymakers and human-serving organizations across a wide circle of stakeholders and key partners in the HHS sector. Speaking of connecting, I invite you to join us at one of our in-person national conferences in 2022. Registration is now open for the APHSA National Health and Human Services Summit, where we will be celebrating the 90th anniversary of the association. The call for proposals is now open for the Economic Mobility Wellbeing Conference, the NSCTA Conference, and the AAHSA Conference. We encourage you to submit your success stories of how you are changing lives across the country. Registration for these conferences and the ISM Conference and Expo will be opening in the coming months. During the webinar, please put your questions in the Q&A pod for the presenters. It is now my pleasure to introduce our roundtable host for today, the Child Welfare Practice Lead for Change and Innovation Agency, Kelly Harder. Please welcome Kelly and the panelists to the screen.
Thank you, Donna. It is my distinct honor to host this topic and interest that a lot of folks who obviously by the number of registered individuals, which is over 1,000 on a topic and many of us are living with, struggling with, but also see an opportunity for change that we can do something about with this. I myself want to just thank APHSA. I've been around and with this organization in about every capacity possible through over a couple decades, which will age myself, but I'm okay with that. But if not for Donna, if not for Tracy and the leadership of this organization who put together a tabletop for national experts and thought leaders to come together year after year to influence policy, inform practice, and better the lives of children and family and adults who so need help when they need it year after year. So just thank you, Donna, your team, your staff, the technology folks who are running this webinar today. We just sincerely and genuinely appreciate you for all of this. Folks, my name's Kelly Harder. I have the distinct honor and privilege. I work with Change and Innovation Agency. And this is something dear to our hearts. I'm the child welfare lead. And as we go across the country, we're seeing that which is a capacity crisis played out with staff and turnover. And we really see the opportunity to engage thought leaders and what are they doing to take this crisis of a capacity that is manifesting itself in the symptoms of turnover and create a turnaround and create the opportunity going forward. So as this visual shows, we have more coming in than we do going out in regard to staff, and they're staying with us. Myself, I've been in the field for many years, 27 plus years as a worker, supervisor, was a director in counties, also worked along with the locals at a national level with APHSA. So I have the distinct honor today in being the host to this work as I'm waiting for the slide to progress to introduce you to the panel. The first panelist I want to start with is Kate Garvey. We are very honored and blessed to have her with us. She's the director of the Department of Community Human Services for the City of Alexandria. Kate, you will meet no other national thought leader with more dedication, commitment, experience, and expertise, other than the rest on the panel, of course. But I've had the honor and privilege to work with Kate for many years and thank her for her time. Lisa Merkin is Administrator for Child Welfare Services for Montgomery County in Maryland. There's one constant I've had throughout my decades of work. If you want to see what national leading practice, national leading data infrastructure, full human service work that goes on in a human service agency and phenomenal practice around disproportionality and equity, it comes from Montgomery County year after year, and we're just so blessed to have Lisa joining this conversation. Mr. John Rubin, he's the Deputy Secretary of Pennsylvania's Department of Human Services, the Office of Children, Youth, and Family. John has his perspective to this topic. You couldn't ask for better optics, and the fact that he's sitting at a state level right now. He's been at the county director level. He's worked at APHSA on a policy level, and he's also practiced himself. So we're very fortunate and blessed. And then I'm so excited that Dr. Deborah Shropshire, who often reminds me, Kelly, just call me Deb or Deborah, that's fine, joins us as the Director of Child Welfare for the great state of Oklahoma Department of Human Services. She and Secretary Brown are kind of like not asking for permission, and they are just leaning forward and innovating in a way I've never seen, in an unprecedented way I've never seen as a state nationally. And her perspective comes from the healthcare being a primary physician. And so she comes at, in her optics, of what she sees from a systems issue, a staffing issue, a policy issue. She brings a different industry perspective, but is so impactful and thoughtful. You're just going to love, I know as well, what she has to say. So as we get going, here's a few of the ground rules for today. First and foremost, I want all of you to know, as we prepared for this, sometimes I think, well, there might be a question about, did you think about this as a recommendation that you're about to offer up as a panelist about, you know, the health and safety of the kids or your staff? And I want to assure you, every one of these panelists put the safety, well-being of their staff, of the residents, of their children and their families first and foremost. So you will not hear anything from them that they haven't thought through that perspective to make sure that families and children are first and foremost, along with the safety of their staff. We're going to follow a panel presentation format. We have 3 set questions with one at the very end that I really like, which is, what would it be? Why would I take an hour out of my day to listen to a 1-hour panel conversation? And it's this: they'll leave you with what you could do tomorrow to address this situation. So stay tuned for that. I'm going to ask the questions. We'll go around. And then also, if you have questions, we have 10 minutes at the end. I know that's not a lot, but for Q&A. But if you have questions, go ahead and put them in the chat. If you have a specific question for any of the panelists, put it in the chat. And if they can respond to it while we go, we will do that, but we will reserve time at the end. This will be recorded and distributed by APHSA following the presentation as well. So know all of that as we go along. As we transition to our first question, I, in preparation for all of this work, was quite fascinated myself when I came across a research that was done by Tolan in 1960, folks, right? This is 60 years ago. And it was staff losses in child welfare and family service agencies, where agency directors reported that staff turnover handicaps their efforts to provide effective social service clients for 2 main reasons. It's costly and unproductively time consuming. And it is responsible for the weary cycle of recruitment, employment, orientation, production, and resignation that is detrimental to the reputation of social work as a profession. Folks, this was 1960. We've had chronic 20 to 60% staff turnover since then as an industry, up to 60. And as of today, about an hour before this, someone sent me a thread of a newspaper article in a large city in our country. They're at 80%. Now, I don't say that to go, oh, if you're under 80, 60, 40, or 20, you're good. National standards in the private sectors, if you get over 10%, they're hitting the red button, they're stopping production, and they're figuring this out on what we do going forward. But somehow, as an industry, it feels a little bit like, folks, I'm going to say it at the end. I don't want the next generation in 60 years to admire this webinar we're about to listen to and wonder why we didn't change anything. So it's on us, right? It's on us to address this capacity crisis, and it's through systemic and also real life today in the life of what are we going to do about this work. And it costs over $54,000, research shows, on the cost of transitioning a staff when we lose them. Finally, Casey findings in 2017 said, due to stress, emotional exhaustion, job satisfaction, and the perception of the organization's commitment to the employee is why people leave, okay? The Great Resignation we're hearing about, right? The themes there are work-life balance, flexibility in work hours and location, employee sense and stay in an employee sense of their say in their work, and pay and feelings of appreciation. This resignation issue is not unique or different to the findings that Casey and other research and institutions have had before this. So with this, I'm going to lean into our first question that we have for the panel. And it is, what are you doing in the area of recruitment? And Deborah, I'm going to start with you for that response.
Yeah, thank you, Kelly. And it's good to be with all of you. Thank you for joining this time this afternoon. Hopefully we can provide you with some points that might be of interest or might be useful to you. In Oklahoma, I'll just lay a little bit of context that points to where we are now with recruitment. Prior to COVID, we did not do any kind of telework whatsoever. I think less than 1% of our team was teleworking. And so it was quite a culture shift, forced culture shift to be able to send our staff home and try to figure out how to do all of that kind of work. Even before COVID, obviously, like many other child welfare systems, we faced turnover challenges. But during that time, that year or two, couple of years, continued to see employees, good employees, members of our team step away for one reason or another, some to other jobs, but honestly, many because of issues such as childcare and needing to stay home with children or family illness or personal illness, those kinds of things. And so one of the things that we have, one of the strategies that we've kind of undertaken as the COVID world at least seems to be settling a little bit, and we're trying to think forward about what, in a sense, our new child welfare workforce will look like, what kind of folks we should recruit, and also I hope we'll talk about kind of how we support staff in terms of retention in kind of the post-COVID world. One of the things that we did is said, hey, there were team members that for one reason or another stepped away, that they were our friends, they were our colleagues, they already know how to do this work. Let's go back and get them. Let's imagine that actually working for human services, working for child welfare is a job well worth doing. We believe that. We have a very strong, I think, mission focus in terms of our work with families and kids. And it's a good mission. It's well worth doing. And over the past couple of years have made some really good changes, I think, to allow for more flexible work schedules, different ways of operating and working. Let's go back and get those folks and say, hey, we want you back on our team. We miss you on our team, and give people permission to come back, as well as actively recruit our friends to the work. I'm a fan of working with my friends. And so we actually package that in the form of an incentive package where if an existing staff member, case carrying staff member recruited a former employee who could come on and carry a case fairly quickly, where we also didn't have to spend a lot of time with training. Not only would both of those team members be compensated, but also we said, let's tie that together and result that, and in a year, if you're both still here, there will be additional compensation for that, because we want you to support each other, and created kind of a recruitment and a retention strategy. So that's just one of the approaches that we've taken, is going back to get our good people who may have left for a variety of other reasons during this past couple or 3 years.
Thanks, Deb. That was a phenomenal. I remember when I first read that, I was like, but government would find more reasons, and within law and bureaucracy, like that's too private sector. We don't do that. And this is what I'm telling you folks out there. Oklahoma is just doing what's right to make it work within bounds and legal. I'm sure I know that, but it's just making it work because we have to. Lisa, would you like to speak next, please?
Sure. Good afternoon, everyone. Thank you for allowing me to be here. So I'll follow up with what Deb was saying, is, this big question about how do you obviously recruit staff that want to stay. So some creative ideas that we have done county-wise, and of course with our wonderful partners at the state, have been listservs, alumni listservs. Where do we think these students are coming from? How do we question and how do we bring about really the good work that public child welfare, because that's what I'm looking at, does, and raise awareness about that. So it's a matter, I think, of partnering with the graduate programs, the undergraduate programs. What's the value in the work that you do? Because I think once people get connected to the work, they really don't want to leave. And I know we're going to get into this retention question next, but I think these creative ways of thinking about how do we get staff to the agency. Of course, telework really sort of changed what our work is, and it allowed us for a lot of creative thinking. So telework in the office, out of the office, what flexibility do we have to do paperwork from home versus being in the community, meeting our families and our children. So to allow that flexibility, I think we have had to pay attention to the work-life balance and being able to share that with people that are coming into the agency and we're trying to recruit is what's the good work-life balance and how do we encourage that with our staff for their own well-being. So I think those creative ways of thinking maybe outside the box that we might not have thought about prior to the pandemic has really allowed us to think creatively which staff want to come and how then do we end up keeping them.
Thank you so much, Lisa. That's great. And you're going to lead as you prime what we're going to be getting into on the next one as well. Kate.
Sure. Thanks so much, Kelly. And I also appreciate the opportunity to be here. And I'm looking forward to not just questions, but feedback, because I know there's a ton of great work going on out there already. So I'd love to learn from the more than 600 people participating right now. But a couple of the things that we've focused on, one key for us is finding staff who reflect the families who we're serving. So really doing outreach through diverse media, social media, and really looking through the lens of Latino connections, African-American outlets, and really trying to reach individuals so that we have a workforce that really does reflect those who we're serving. And linked to that, and I think linked to both the things that Doug and Lisa both said is, what's the reputation of your organization? Do people know what kind of work is taking place there? And so that they want to be part of that, and how do you promote that? And I think that's something that we don't typically pay as much attention to as we should. When we think about private industry, they do. And how are you known out across the field and in the universities where you're doing, having interns come? Do they know that they're going to have the opportunity to be progressive? Are they going to be able to move up in the organization? And the degree to which you're really promoting the practices that you have that make you an employer that people want to seek out. And I think that piece, we a lot of times underestimate the promotional aspects of our work, and that's a piece that we really need to continue to grow. And so people know, I want to go there, and I know if I'm there, that's actually a career for me versus a job.
Thanks, Kate. I hear often is that we're going to be the employer of choice. And I always say, well, that's the easy part, is not you, but I've heard this elsewhere, that you put those words up and then, but how, right? And and not just in the flash, and we can get people here, but how do you stay and want to put your name and be part of that organization? Before we go to John, we have 3 quick questions. I think we can answer these actually quick, which I said we were going to wait, but hey, this is Kelly. We'll just roll with them. Deb, there's a couple questions on Oklahoma. Did you offer a retention bonus after a year and or a retention bonus for staff and or former employees who came back, ?
Yeah, so I put a little bit more detail in the chat. So if you have questions about that, happy to provide anybody who wants to reach out with our plan. But basically, it's a recruitment bonus for both the staff who did the outreach, as well as for the person who came back, and a retention bonus for both at a year. And our guidance to them is that your job is to support each other. And the better that you support each other, the more likely you're both here in a year, and you'll both be bonused again. And we put some pretty good dollars behind that, about 15% of our total training costs, because those returning staff wouldn't need the same degree of training, if any, as if you hired a new person. Plus, we felt like they already kind of knew what they were stepping back into, which is a little bit different than say a new recruit who's coming into the field cold.
Thank you, Deborah. John, we'll jump to you, and Travis Erickson from the great state of Alaska. I got your question down, and we'll get to that toward the end. I think it's more of a global question about work-life balance as well. So, John.
Yep. So thanks, Kelly. And let me build on a little bit of what others said, but Kate talked a little bit about promotion. So I do want to share that in Pennsylvania, we're going to take the opportunity with April being Child Abuse Prevention Month and really doing a lot of media around that, but taking that opportunity to not just do some of the things that we've done in the past, but really talk about the people, trying to find the people who have the heart for this work, and using the opportunity of this month to not just do the commissioner proclamations and things like that, but it's really an opportunity to build on that recruitment and promotion in the communities. Part of why I'm on this panel is really as the representative of the state supervised but county administered states. And so really very much our role in Pennsylvania at the Office of Children, Youth and Families is to help support the counties and to really work with the individual counties. We don't look at this as a one size fits all problem, but really how do we support we've got rural counties and urban counties and big counties and little counties. And I can tell you that our fiscal staff has been working individually with the counties and offering the counties understanding of how they could potentially repurpose funds for recruitment and retention. You know, there's like a difference between a bonus payment versus an incentive payment, and what can they do and what can't they do. I think sometimes counties feel like they can't do X, Y, and Z, but maybe with a little bit of nuance they can. And so supporting from the state perspective what can be done versus what can't be done. I also do want to share that in Pennsylvania, we're blessed with a great training program. Our Child Welfare Resource Center with the University of Pittsburgh has partnered with us in really helping the counties see their data on their staffing. They've gone through the annual needs-based budget documents that they submit to us, that the counties submit to us, that include some of their staffing. And we've developed really, I shouldn't say we, the Child Welfare Resource Center with our partnership has really developed data that's county specific for the individual counties and helping them see their own staff turnover and looking at themselves in the context of the state. So really trying to get more local, I guess is one way to put it, at the state level, is something that we've been trying to do to support them. And in that realm, and I'll close with this, we've offered at the state level to meet with, I've had a number of calls with counties, county commissioners, encouraging them with salaries and again, bonuses and the things that they need to be supported to know what they need to be doing to keep their child welfare casework practice going. And so really from the state perspective, not just living at the state level, but trying to get down in partnership with the local communities.
John, thank you so much. You know, John, when we were preparing for this call, I really loved, and having worked in a state supervised county run too, but I think this would be true even if you're state run, state supervised, you're a regional director or your regional leadership in supervision. We spend a lot of time doing that, which has always been done, rarely to ask the question, could I do it? Should I do it differently? And just ask. I think John would say, he wishes the counties might ask more to say, why do we do it? Do we still have to do it when they have a better idea that might affect bringing staff in? And then the other point, I think we often, because we're in such a capacity crisis, it's like, how do we get a body in the door, train and get them out? And so often, like a good case plan, the amount of time we spend on the front end is proportionally related case goals, and I think how well the worker has from a worker experience when they come into the work as well, is how good is that job treating them. That onboarding is so important and critical as well. Okay, next we're going to go to the next question. And by the way, we're keeping track of all these questions, so keep pumping them into the chat. That's great. What are we doing to retain staff? That's the next bucket of work we saw as a theme. And Ms. Kate, you're going to start us off with that one.
Great, thank you. And I think with all of the strategies that I talk about, I am not going to say that we have perfected this in any manner. And in some cases, we're just in the midst of trying to develop some of these things. And, you know, for me, one of the most critical retention tools is a good supervisor, a supervisor who understands who he or she is working with, who really supports their development and also creates opportunity for people, for the staff to actually drive things, to design things, to be in more control over what's happening within the organization. We've been spending a tremendous amount of time within our organization focusing on racial equity and disproportionality and the really powerful way that our staff have recognize what is taking place within the organization and really recommended shifts and changes that we need to make, I think is a powerful retention tool. The more that staff recognize that their viewpoints are valued and that they have a greater control over what's happening, that's very, very significant. An area that I think is very, very important, but we have not moved enough forward on this, but I do want to talk about, is really looking at the administrative demands that are placed on our staff and trying to think of a different way of managing those things. So from, while we all recognize everybody's got to do paperwork, this has been let's talk about a report since the 1960s. It is thinking about how do we use our time well, and looking at the expertise that our staff have. That needs to be focused with families. Certainly they have obligations and responsibilities to report and to really be taking time related to documentation, but are there other things, are there administrative supports that can be given to them, including transportation assistance and others, where they can focus on the work that they came to do? And I think that's a piece that we're really wanting to look at much more, and thinking through the staffing patterns that we do have. So those are just a couple of the things that we're focusing on right now.
Thanks, Kate. I hear so often, and I think if there's one constant, I came into the profession to work with children and families, right, to get to thrive in and better, and I'm spending all my time with compliance and paperwork. And we say, well, that's the business, but it doesn't have to be, right? This is a system, and the system has multiple parts. And your point about, we wouldn't take our best receiver and say, well, we have a hole at the center on the football team, so go have them hike the ball. Like, we wouldn't do that. But somehow in our industry, we're like, well, we can't, we have social workers with MSWs, because we have to, but getting kids to appointments and getting them to sporting events, and it's hard. And I'm not trying to understate that, but I think differential response, differential responsibility tied specific to skill set of staff is something that, I look forward to how we continue those dialogues. John, would you like to offer up some work you're doing around retention and staff as well?
Yep. And just to build on this thought, one thing I would specifically say, if you're looking for a concrete strategy, is stay interviews, I guess. Instead of doing exit interviews when people leave, you should be talking to your staff about why they are staying. So I think Kate hit a lot of the key points, but really trying to not just assume, but really talk to your staff. I think they would appreciate also being engaged. This is something we'll probably talk about more. Just this idea of retention means including your staff in these discussions. And so I think doing those stay interviews is one specific strategy. From the state level, we are really looking at some regulatory changes. We are looking at lowering caseloads through regulation. We've been talking about this for some time, but we're proposing regulations. Right now in Pennsylvania, it's a cap on 30 caseloads, cases per worker, and we're proposing to get that down to 15, laddering it down over a couple of years. But I think saying to the workers, we understand how hard this work is, and even though that'll be a challenge to hire the staff that we need to lower caseloads, I think the message to staff is this is what we're trying to do, that we recognize the difficulty of the work, and we are from the state level trying to do what we can to acknowledge that and work through with the legislature through regulatory changes that will really almost force our hand to support the caseworkers.
Thanks, John. I go around the country. It's fascinating where the variety of those ratios, and some have worker to case loads, some have worker to case counts, right? So they could have 3 families and have 15 participants they're working with, individuals that are on those cases. And I'll tell you, this work is so hard. It doesn't matter if it's 1 to 15 families or 1 to 15 total members in open cases. No one has enough time to do the work they feel like they need to do, which is something for us as a system we need to continue and talk about how the cases flow, as well as how many case loads of folks we have. Hey,
and Kelly, I'll jump in and say, along with that, we are also trying to limit the supervisor to worker ratio. It's been mentioned again, the value of the supervisor. So trying to keep that at a 4-to-1 ratio, so the supervisor has time for the worker as well as part of the process.
Excellent. Lisa.
Hi, so I think I'm going to tag on to what has already been said, and I'm just going to throw out some ideas. I think this idea or the mandate that the supervisors are really the linchpins for so many reasons. They're mission critical. They really are supporting the staff, because when you do exit interviews or even stay interviews, what people will say is, my supervisor was wonderful. And you want that because that's a connection to the agency. I think again, the pandemic and telework taught us a lot about people's connection to each other as a team, to the agency, and to the mission. So looking at a really strong, what we've been doing here is a really strong onboarding orientation to get staff connected, not just to their peers, to the administration, but also to the work and what they can expect. And I think that then bleeds into a really strong succession planning, because we can plan for now and have our staff stay, but where are we going to be in 3 or 5 years? And you want those staff, when you're investing in them, to stay. So I think the succession planning is really important. I think another really important thing is looking at staff morale, which you can certainly get from stay interviews or exit interviews. Unfortunately, sometimes too late, but monitoring morale, because I think, again, when people feel connected and they feel like they're being heard, how do we allow our staff to be part of agency decision-making when appropriate? Where is their voice in agency policy or whatever you're deciding in your agency? I think when people have a voice and they know that they're heard, even sometimes when the answer is no, we can't do that, but thank you for sharing, people become vested in their work and in the agency. So we've really been looking at creative ways to bring that staff voice in, so that people in leadership roles can hear them and staff know that they're being heard.
All right, thanks, Lisa. Deborah, do you want to finish off this topic, affirming or something else you have going on in Oklahoma?
Yeah, just a couple of things I was thinking about as I was listening to this great conversation. One is we literally, we went through so much change getting people out to telework, and we actually closed about half of our office buildings, which we did initially as a strategy to deal with what we thought were going to be some budget cuts early in COVID. And then eventually it became the strategy because we just simply didn't need the square footage, because we see the future of our work still having a pretty strong telework presence, even though we'll use offices, but it's just not the same. So because of that, you can imagine everybody's world was turned upside down. We had to just go to our staff and say, what do you need to do the job, and make a big list and start working on those things one thing at a time. And we've kept doing that. So we did that at the beginning of COVID out of sheer necessity. Now we do it out of an effort to really hear from our team, and then to demonstrate that we're listening to you and we're solving your problems. And so we've created a much stronger feedback loop and improvement effort between our frontline staff and all the way really to the executive team. So that's one thing I think that has been really important. And our staff now feel quite comfortable reaching out and saying, hey, you said you'd help with, and we need this, whatever. I saw a number of comments also in the chat or questions about, are people using positions in a different way? And I will tell you, we're just starting to turn some of our vacancies for our frontline staff into other kinds of support positions, because we have seen the vacancy rate go up. We've also seen the number of applicants go down. And so at some point you have vacancies that are budgeted for, but you don't have bodies. Can I find different kinds of bodies to be able to use for, whether it's things like serving as a scribe, doing things that are those kinds of activities, in a sense, that keep our frontline staff from doing the people work that they want to do. So we don't know if that'll work yet, but we definitely are turning positions into other kinds of positions in an effort to try to figure out how to utilize all the resources that we have.
Thanks, Deb. And as we transition to this next slide, as far as what we're going to do long-term, and just have John kick that off, I remember, Deb, when you had said, and so true from the medical perspective, right? You don't have doctors type in their notes. You don't have doctors, well, I'll also add to this, you don't have doctors go and get the patients and bring them to the emergency, or, to the office. And yet somehow over time, out of necessity and importance, right? The social work industry or the human service child welfare, we've out of survival done that, but at some time, I think this leads well into this, is what are the systemic long-term strategies we need to be thinking about? There's private sector industries that, fought the high turnover and finally said, high turnover is a reality for the foreseeable future. How do we change how we operate as a system and our processes? That means we have to look at our processes differently than we have historically. So with that, John, why don't you go ahead?
So thanks, Kelly. And I'm going to talk maybe less about process and more about just where child welfare is going as a field long-term strategy. As everyone knows, we are trying to get further upstream. We are trying to get more oriented towards prevention services, building stronger communities and healthy families before there's a report of maltreatment and before the child welfare system gets involved, diverting families from child welfare to mental health or other services. And we're doing that, I guess I'll put it under the heading of Family First, although many states and counties have been going in that direction for many years. But I'm going to connect that strategy to workforce, because a lot of times I'm talking in my state to counties or partners about Family First, and they're looking at me saying, how can we do, you're bringing this big initiative and we don't have workforce to even do some of the day-to-day work. And I'm trying to make the connection that this work of prevention is about supporting the workforce, that if we can actually implement a lot of this work, if we can actually divert families from the child welfare services safely, if we can protect them in their own community with other natural supports, we could lower the workload, the volume of work on the child welfare caseworkers. So if we sit here and say, well, we might not be able to get X number of new workers, but we might be able to lower the pressure coming in the front door safely. Again, not just screening everything out and not answering the phone, but building these stronger community infrastructure and system. I think all the work that we are trying to do as a field, the way we are trying to change child welfare to be more upstream and preventative, although it feels like an initiative that draws away from our resources, is really connected to the long-term strategy to need a smaller child welfare footprint for those more serious situations where child welfare intervention will be required. So that's my soapbox for the day.
All right, John, we love it. Love you for it. Thank you so much. Lisa, would you like to offer up some thoughts there?
I think we would probably all agree with everything that John just said. I think, big picture is, where are we looking at the needs of our family and children, because that's what our work is really focused on. And how do we see the system changing, and then how do we adapt to those changing needs? So it is thinking up system, and it is somewhat overwhelming to think, but when you start collaborating and talking about with your schools and your other mental health partners, your community agencies, your family preservation agencies, I think there's a lot of value in bringing those community partners together to say, what are we seeing as changes, and how do we use those resources? Because it doesn't all have to fall onto one agency, but how do you share those resources so that we are making sure that positions are filled and our children and family services are needing? So it's not a tomorrow answer for sure, but it is some longer term thinking and planning about where do we think we're going to be in 2 years and 3 years and in 5 years.
Lisa, when I think about, and thank you for that, and I think something we as a system really, in an industry, really have to grapple with is the workforce today, this generation of newer workforce coming in, and it isn't bad, it's different, it's new. This is not the workforce of my generation or the generation before, and there comes a point of us admiring it and then us changing it. But that means, many staff start and they're like, you're gonna make me work on a cobalt green DOS based, I don't do that. Here's my phone, tell me what I need to do, and if they don't like it, they leave. And some self-care, maybe they're better at that than I know my generation was, but I think, what your point about accepting this and understanding what is the future workforce and the current expecting from the employer, and then how do we pivot on that, which has its challenges, obviously, in government as well. Deborah, would you like to add some more to this conversation?
Yeah, I think in the same way we were kind of talking about prevention, I think we also have to think about what are we going to have to build for the next iteration of the actual foster care system. Because in Oklahoma, what has happened for us over the last 6 or 7 years is we've seen a steady decline in the number of kids who are in care by about 45%. So we have fewer kids in out-of-home care, but the density of complex kids is higher. And we actually certainly saw that happen really in the last 9 months or so. It feels like the first 12 to 15 months of COVID, kind of we rocked along, but the last 6 to 9 months, many more youth entering care where parents are struggling to find resources, maybe the sort of hit or miss at the school or with juvenile justice systems or mental health systems. I know nationally there's been a lot of challenges accessing higher level kind of psychiatric care. And so we're seeing those children those youth come to our attention, and they're complex, and we already had some complex kids. So even though the number of kiddos in our out-of-home care is lower, the density of really complex kids is higher. And the result of that is it's more pressure on that frontline worker who happens to have one or two or three of those kids kind of on their caseload. We've done a lot of really hard work on caseloads and on supervisor workload and things like that. But we're going to have to build more supports. I think teaming has been something that, I mean, I'm sure there are organizations that have done teaming well in the past. We had not done a lot of that for the last several years, but really thinking about how you have a group of staff that are supporting some of those more complex cases or more complex youth, thinking about what other kinds of support services can we bring in through contracts or other kinds of things, although those contractors are sometimes finding difficulty finding staff as well, so it's not that easy. But we're going to have to build a system that doesn't have a caseworker sitting in an emergency room for 2 or 3 days waiting for a psychiatric bed, because that is not only the situation we're in now, but it is, I think, likely to be the situation that child welfare systems will find themselves in as they're successful with upstream work. In a sense, like medicine, the better we got at home health and prescription medicine, and you can have an IV at home and all those kinds of things, the fewer people were in the hospital, but those people were really sick. The foster care system could be the same. As we're able to address poverty and a lot of other issues that result in the ability to keep families home, the families and the kiddos that will enter foster care will be the intensive care situations. And we have to build supports around staff that look like intensive care teams.
Great.
Deborah, if I could jump in, I just really want to emphasize some of the things that you're saying. I don't think we can miss that. Child welfare is not the only field struggling with staffing. So as mental health and school, others are struggling with staffing. I think that the time is right for the teaming concept. Anybody who's struggled engaging partners in your community in the past, they might be more welcome or more able to come to the table now, because it is a crisis, not in child welfare, but really in human services. And really the best solution is the teaming and the collaboration to support the children, youth, and families.
All right, Kate, you want to finish off this topic for us on this question?
Yeah, and I couldn't agree more with what's being said. That it is not unilateral work. It's not work that we do on our own. We must do it together, and recognizing the different values that different parts of the system play. And I saw in the chat also talking about challenges where there are parts of the systems that at times are not respectful or supportive of social workers or others, and the degree to which we build that level of support and true understanding of what the staff is doing, of what people are trying to accomplish, and the shared responsibility we have to really respond effectively. That is essential. I think where you have people very committed, working as hard as they can for the right reasons, and yet feeling really ground down by the other parts of the system. For me, we've got to be able to fix that. And we do see, we have seen, model courts that are amazing. And we've also seen places where there doesn't seem to be a true connection. So I think in all of this, it is a systems approach, ecosystem, whatever you want to call it, who all needs to be around the table. Are we equal in this? And equal means including family members. Mm-hmm. And do we all have the same goal in mind? And what are the barriers that we face that keep us from really moving to what we all want, which is a safe and loving environment for our children and for families to be successful in the way that they want to be successful. And so I think it is at all times calling the question, because oftentimes we just say, yeah, well, that's how that part of the system is. We just have to deal with it. No, it doesn't. We can't be successful unless we bring it all together and we have shared accountability and then the shared success. And so, it's everything, right? Always.
Kate, thank you so much. Hey, I just want to mention, everyone keep putting everything you are in the chat, because obviously we'll lift that out and be able to build responses to this over time. I don't think we're going to get to everything. My other point is, can you see how amazing this panel is? And my joy of just getting to sit with just these thought leaders, I just cannot say enough about how they're approaching and what they're doing at this work. The other thing I would say, and I see and hear this often too, I think so much of centering the voice, both of the families that we're working with, but it's the staff and it's the supervisors. But I will also say, in your agency, if you're not going to honor that feedback and then create a solution with their being part of it and giving them some, and I know, right? And then they need capacity to help implement what those recommendations are. That at times we all know can be even more lethal than having question to start with, but we hear often, well, we're asked again to be part of the solution, and then they offer it, and then they don't feel like their voice, it might have been centered for the process, but not necessarily the implementation. Okay, we're going to do a quick round robin here before then we go into question and a lot of questions, hopefully some answers. Please keep putting that in the chat section. Lisa, we'll start with you because you're the one who hasn't started any of these questions yet. So what one actionable thing would you offer up to the audience to help them address their turnover issue? The one thing you would offer up as we move toward the tail end of this conversation.
So this is a game day decision for me because I've really been thinking about this question. I've changed my mind like 3 times even during this conversation. So I think, of course, I can never just say one thing, but I'll try. I think the one thing is I think we do need to look at our positions and how we use these positions. And we've all talked about this theme is that, is it one person that needs to do everything? And I kind of think about it as a wrap model, like how do we wrap our staff with the services they need, whether it's a social work, whether it's a community service aid, whether it's a parent aid, like what are the services that we want and need to deliver to our community, and how do we use those resources that we have? And it even goes a little bit farther, saying how do we collaborate with our partners to help in that? So I don't think it's, even for me, I'm thinking about how am I going to fill my vacancies tomorrow? I don't think that's my answer is not going to help me for tomorrow, but I do think that is a real concrete, tangible thing we can think about that can help us in the coming even year to do that. So I think that's for now. If you came back to me and 3 people later, I might change my mind. But I think that's what I'm sticking with for now.
Lisa, I love that. Like I hadn't thought about that. Is amazing. Like think about how much our staff put toward wrapping, right, supportive services around families. And yet how do we put a mirror up and how do we as agencies and systems wrap that same level of support around our staff so they then can go out into the field and be that successful and feel supported with the family.
Yeah, I was also just going to say is I think sometimes our staff want to be able to do it all. And that's what's so wonderful about our staff. And so we have to sometimes help them say, no, I don't have to do it all because here are the supports that we can give you to work with the family and make an impactful change. So it's not just the systems, it's having the staff understand what's their role and how can they ask for some help in helping the family.
Right. All right, great. John.
Thanks, Kelly. And I'm going to build a little bit on what was just said. One thing I will say first, though, is that you have to start with a sense of that this like a positive outlook for the future, that this can improve, that we can't start with what we can't. We have to think about that we can. We just have to think about this differently. And as we do that, I want to say part of what was already said, which is engaging the current staff, but not just like surveying the current staff and not just asking them why they stay, but really engaging them in the planning process. And I think that would be much more sustainable. Like, I don't think this is going to be, all right, we got the answers today and then it's all done in 6 months. Like, this is going to be an ongoing challenge. And I think it's an opportunity to really embrace the engagement of staff and a continuous improvement of your agency. And it may start with a staffing challenge, and then you may choose to engage staff in other challenges in the future. So my one concrete thing that I was thinking of, I tried to put myself, if I was a county director today, what would I do? I would look to create an actual planning effort, but I would include the frontline staff, but also secretary or administrative staff, other support staff. It's really, again, throughout the agency. So I would be including them in it. Sometimes as leaders, we think we have to solve the problem, right? Sometimes as leaders, we think we have to come with the solutions. We have to tell the commissioners what we're going to do. And that's what I'm saying is spread that out, make this a shared responsibility, open yourself to the input from your staff is my one concrete suggestion.
Thanks, John.
Actionable thing you can do.
That is very actionable. Thanks for that, John. That's great. Kate.
Well, since John took mine, because I was just going to say,
I'm so glad I went before you then, Kate.
And so I had one that was very, very concrete and one that was not, that is much more, will take more doing. But, one of the conversations that we hear all the time is the need to really address the shortfall for public safety. So that raising wages for public safety folks and doing everything we can to support public safety folks. And for me, it's, while I don't want, we should never be seen as public safety. I'm not making that equivalency, but the sense of urgency with which public safety staff are looked at and the necessity for them to be paid adequately and supported adequately. I would like us to get child welfare social workers and all who support that work seen in that same light. And again, no equivalent, nothing related to we are the police, but it's this sense that if we don't have a strong workforce in this area, how absolutely detrimental that is to our community. And to move the thinking, you know, and certainly through COVID, we've been very fortunate where we have been seen in many times equal to, you know, the necessity of public safety, human services was there too. So how do you, you know, take that learning of saying, hey, if we don't pay attention to this piece of our community and what's happening there, the consequences are horrific, and we know long-term. So I know this isn't, it doesn't feel like the tangible suggestion, but for me, speaking at that level and trying to evoke that sense of urgency in our, you know, policymakers and the funders and elected officials, I feel that's something that many of us need to continue to do. So not too tangible, I know. Sorry, Kelly.
Well, yeah, but you know, Kate, someone in your role at a director role where you do have an opportunity to sit with your county administrator who sits with city administrator and chief police and school superintendents and principals. I mean, that is something tomorrow you can bring the system together if it hadn't been to go, how are we, and to John's earlier point, schools are struggling with this, no different with teachers and classroom aides and supports and law enforcement and public transportation. Like, we are in this together, and the last thing we should do is go to our corners when we are all collectively serving that similar community, our communities, and with different results to different needs. But at the end of the day, you know, you look through across social determinants, and health, safety, and thriving is all interwoven. So how do we help do that? So I do see the tangibility, Kate. Deborah, you get to bring us home on the final answer to the actionability question.
Yeah, I think as I was again listening to all this conversation, I think the thing I would share is just stay flexible. I know companies are dealing with this question of, do we bring everybody back, or do we stay all telework, or do we do something in the middle? And what I would just say is, I think the actionable item is commit to flexibility, but not necessarily to mediocrity. So do flexible well. We were not flexible before, we are now, but we are still learning how to do it with excellence. And whether that flexibility is someone who needs to be in the office 5 days a week because that's how they work best, or other people who actually need to do work a different way, whether it is counties that don't have a human services building because we closed it and we've got to find community partners that we're working with, or counties where we have a giant office no one's in, and we're going to close that and actually create smaller spaces that are more client-centered. Every county is going to look different. The work is going to look different. The flexibility is a must-have. I think the generation of people who are coming into these jobs really are going to need it. They're going to require it, and it's actually what will help us stay competitive. But we're going to do it with excellence.
Couldn't agree more. Thank you so much. And I think that's right. This is our reality. Government wasn't built on its strength being nimble, flexible, and agile, right? In fact, it's built sometimes to be the exact opposite of that for reasons that it has to be, which is protection of taxpayer dollars. And someone said it was built not to change, but we're in an environment that if it doesn't change, there's consequences that we're experiencing now as well. So on behalf of myself as the host, I want to thank my phenomenal panelists, as you've seen. I mean, I will also say to any of you, if you want to put in there, I'm more than willing to say I'll do everything I can. I think they would too. To me, it feels like the beginning of a conversation that we want to stay active in, and that doesn't mean next year at this time. I would say if there's interest in us doing a follow-up, we can do this. We find a way to do it at the APHSA Health and Human Services Conference. This is a real topic, and you are all putting lots of questions both in the question area as well as in the chat area. So let us know if you want to continue the conversation. I'm going to have one there in the Q&A. There was one asked here that I wanted to put out to the panelists as we move into our final 6.5 minutes. What are some successful strategies to recruit Black, Latinx, and LGBTQIA+ caseworkers? I think, Kate, you had talked a bit about you're all really leaning in to make sure you have caseworkers that reflect the communities and individuals of your community you're working in, but I'll open it up to everybody about a response to that.
Yeah, this is one where I'll say we're not fully successful yet. And part of it is, again, what does someone see when they see your organization? Do they see a future for themselves? And so one of the challenges we have, we don't have enough Latinx leaders in the highest level of the organization. Also, is there a level of support, and is there a cadre of other staff where you feel as if this is a place where I'm welcomed and I can move forward? We do have multilingual pay, which I think is absolutely essential. That's got to be done. We also trying to do recruiting in various ways. And I did see in the chat getting a list, and we can get, I don't have it with me right this second, but I can send that out to you where we're sending that. But I think it's very much about and the same thing, is this an environment, and also with the LGBTQ plus staff, again, do I see myself here? What is also the philosophy of the organization? Is there a respect for and a trust in both for resource parents and other things? So it's really seeing who's there, seeing what you're doing, and then feeling as if there's a place there and people to vouch for you, the personal reach out and the sense of this is a place you want to be is absolutely invaluable. And I think that's where, and that's what's genuine. You can talk a lot, and let me tell you, we still have a long way to go. But it's when people see what the environment is, then they'll want to be there. And we certainly need to do more, and we must, especially for the families that we're serving.
Yeah, I'll just say, I think the first step in solving a problem is admitting you have a problem. And so I will, as Kate said, we definitely can do better in this area and are being intentional about it now. We have a strengthening equity work group amongst our own staff. We've talked a lot about this at our Child Welfare Council, and really back to some of my themes for today, which is trying to get local. It's not although we all are sharing the same problem, the solutions are going to be a little different based on the local communities. And we have been trying to talk with our, Philadelphia has had great conversations with us about this and are trying innovative things in Philadelphia. But really, it's to me, it's whether it's state by state, county by county, but for me, getting more local, but admitting that this is something we need to work on as a first step.
Great. So I was wondering as well, there was another theme of questions I saw through here is both in Oklahoma and others. Are you engaging creative finance resourcing to make certain initiatives and efforts happening above and beyond what your traditional kind of HR or personnel budget has been historically?
I think we sort of leveraged everything we had. I'll say it that way. And so we kind of took various funding streams, both regular funding streams, as well as lag when we don't have positions filled, as well as dollars, federal dollars that came in because of COVID relief or things like that, and kind of identified what can each of these things be used for, and made up the strategies we wanted and found the funding to be able to do them. And so a lot of these things were incentives that were not things that we'll have to continue to budget for necessarily year over year, or we'll have to think about how to do that. But we worked with what we had, and then the extra dollars that came in as a result of various kinds of COVID funding. I think we were just really willing to move dollars around, and that is, I think, something that historically people just didn't do from year to year, and we did it from week to week. So
yeah,
I'll jump in and say again, I was trying to say earlier, sometimes you have to say I can instead of I can't. I've talked to my fiscal, I mentioned earlier, we have our fiscal staff working with counties, because sometimes you have to stay within the lines, but you can get creative within the lines, and you can maybe do an incentive instead of a bonus, or there's different terminology and things you can do. The other thing I would say is we haven't really talked about creative workforce, like hours, like 4-day, 10-hour weeks instead of 5-day, 7.5 hour, 8-hour weeks. So a different type of incentive to stay, but maybe it's just getting creative a little bit in the work in different areas.
Yeah, I always say, and John knows this about me too, it's like, I understand the lines are there, but sometimes you can bulge lines without breaking lines. And sometimes you just have to do that, and you prove that it's safe and okay. And that's a way to influence how and where we go with government. So I tell you what, I want to encourage, I have to say this as we're winding down. I want to first and foremost thank this panel, because I think many of you know, you don't just show up and have a panel that just, well, they might say certain things, but they've prepared, they've spent a lot of their time. They too don't have a whole lot of extra capacity, if any capacity, to do work above and beyond. And yet in their day in work, they committed pre-calls, pre-meetings, getting information. I want to thank our panelists for this, for sharing their expertise, for sharing their recommendations. I want to thank APHSA again for this amazing platform to have this conversation. I want to also, most importantly, thank each and every one of you as I'm watching these. We have workers on here, we have supervisors on here, we have directors, we have leaders, all of you who are doing this work day in and day out. I cannot thank you enough for the commitment you've made in your life and your career, sacrifices in your day, your family's lives, your own, to do the work that you're doing so that your community, where you live, the families, the children are safe and they're thriving. And I just thank you all sincerely and genuinely. I think we're going to take all this feedback, more webinars, podcasts. Maybe Donna, I talk with Donna and we figure out an ongoing conversation at the APHSA Health and Human Services Policy Conference coming up, and you all could join and we could do a interactive work and find a way to put on a platform to share resources as well. Thank you all for the work you do, for your courageous leadership and your courage. You're wonderful. Have a great rest of your day and be well. And we'll be in touch soon. Take care. Thank you.